Hello.
Hello, everybody. So thank you and welcome.
Welcome to another edition of Facebook Live. And today we're talking about questions that people with disabilities have regarding the COVID-19 vaccine. Go for it, Carmina.
Hi, so I'm Carmina Cerioli. Hello, co-executive director for PAC. And I apologize. Yeah, let me apologize for that duplicate noise. I don't know what that was. It might have been my computer, so I apologize for that. So go ahead, Nancy.
And I'm Nancy Labogo, the other co-executive director for PAC CT.
And we have Marty McNiff.
Marty.
Good morning.
Who always joins us. Thank you for joining us again. Who does her little magic with the chat, and she will be posting links, and any questions that you may have, feel free to post it and she will jump right in and read them to us.
Yes. And all the documents that Marnie will be providing today will be available on our website and again here on Facebook or through our social media. We'll have them in English and then shortly in Spanish.
All right. So moving on, for those of you that do not know who we are a free statewide grassroots organization. We're affiliated with 4 national organizations: Parent to Parent USA, Family Voices, YASA, which is Youth as Self-Advocates, and the National Sibling Leadership Network. We're dedicated in connecting and empowering families of children and youth living with disabilities or special healthcare needs through support, education, and advocacy. While offering emotional and informational support to families, promoting partnerships with families of diverse backgrounds, and collaborating with healthcare providers are also very important to the work that we do. So we have a list of a few of the programs that we work on, and the heart of our program is the Parent Support Program, which is our one-to-one family matching service. We also provide the Family to Family Health Information Center. So we help families navigate healthcare, education, provide resources, just making sure that their child is receiving all the services that they can. We have our youth program, which is ages 13 to 26. They meet on a monthly basis and they learn advocacy skills and youth leadership. Our sibling leadership network is something new. We just brought that on this year, and that is for siblings 18 and older who have a brother or sister with a disability or special healthcare needs. We provide Charting the Life course training. We have genetic resource and advocacy. We work with the New England Regional Genetics Network. And we provide special education advocacy. We have monthly newsletters, speaker programs, and a bunch of other trainings that you can look on our website at PACT if you would like to see what trainings that we offer. Oops, sorry. Go, sure. You're on, Nancy. You're on mute.
Oops. All right, sorry. So today, as we spoke about, we are talking about questions that people with disabilities have about the COVID-19 vaccine. As everybody knows, we're 2+ years into this. And unfortunately, COVID is still running rampant in all the states and globally, especially with the Omicron variant that just seems to have just spread and spread more. Many people are vaccinated. Some people are still not vaccinated. Many people have received boosters and some have not, or maybe some have received one and need to get another. So there's still a lot of questions that people have, still a lot of confusion. And so we need to keep talking about it. Right now, the dominant variant from Omicron is the BA.5 variant. And so, you know, it just seems to keep going and going. So this project is sponsored through a mini grant from the Family Voices National Network. in cooperation with the AUCD, which is the Association of University Centers on Disabilities. Many of the states have these similar grants of family-to-family organizations and family voices across the country. So we're going to talk about some of the questions that people have right now, and specifically we'll address some questions that people with disabilities have. And then obviously, because we're in the state of Connecticut, we're going to talk about Connecticut specific resources and supports that people can still take advantage of. So one of the questions that we hear right now is, do I need to wear a mask and avoid close contact with others if I'm vaccinated? Obviously, there was a mask mandate, before. Right now, the mask mandates in many of the states, including here in the state of Connecticut, have been lifted. Some places and businesses still have not mandates, but they still require people to wear masks. A lot of the hospitals are still requiring, and healthcare organizations are still requiring people to wear masks. So so generally, if they say that if you're up to date with your COVID-19 vaccinations, you do not need to wear a mask in an outdoor setting. It's recommended that you check your local COVID-19 communities for recommendations on where to wear a mask indoors and take any additional precautions that you need to take for yourself with a COVID-19 vaccine. And if you're immunocompromised, it may still be a good practice to wear a mask. So the bottom line is you have to know what works in your state, because all the states are different. I think if I speak for myself and my family, everybody has to do their own risk analysis and see, what, the makeup of their family. And if you have immunocompromised individuals in your house, people with disabilities, I've chosen to continue to wear a mask because that's how I feel safe. And, my children do. We all wear masks, obviously, in different indoor settings, just because that's the way we're comfortable. So it's about, you talking to your healthcare provider and you as a family talking and seeing, what makes sense for you. But that's what right now the CDC guidelines are checking your local community for recommendations. Next slide, Carm.
Okay. So do I need a COVID-19 booster? So the CDC does recommend that you do get the COVID-19 vaccine because it is effective and it's, to preventing severe illnesses. And it has studies shown. I mean, many of those that do get the vaccine may end up with COVID because that's something that has always been said, oh, I got the vaccine, I won't get, COVID, but you will get it sometimes, and it'll hopefully and should not be as severe as if you did not have it. So that definitely studies have shown that. And they do suggest that people ages 65 years and older and that are autoimmune, get that booster and the second. The variants, like Nancy said, further emphasizes the importance of vaccinations. So to prevent efforts, they do suggest that you should get the booster shot. And the data shows that the mRNA booster increases the immune response, which provides protection against getting the severe, as we stated earlier. And now the CDC recommends that anyone ages 6 months and older can get the booster, can get vaccinated, and the booster for everyone 5 years and older is eligible. And at that point, some are just for one and some can get two.
So what are some of the risks with the COVID-19 vaccine? So adults and children may have side effects from the COVID-19 vaccine, including, getting pain like at the site where you got the vaccine. I remember, you can get redness and swelling right at the site. You could feel tired and have a headache, muscle pain, chills, fever, nausea. A lot of other side effects are really, really rare, but they might occur. And so, everybody is different. You just don't know. But I think, regarding the pain, there are things that healthcare providers have, they give advice on if you do, maybe taking some Tylenol to help with the swelling, just like, you do or your child does after you get like a flu shot. And some people don't have any of the side effects. So it's really, we don't know, but of course, as with any medication, there's always side effects and risks that could occur.
So here's a good one. Yeah. So should kids with special needs or disabilities get vaccinated? Absolutely. It's recommended everyone 6 months and older get the vaccine. And because children and youth with special needs and special health needs and disabilities may have a higher risk, because not only, they may have other health risks. So that they feel that, yes, they should be getting the vaccine because it will help with any other underlying conditions. Oh gosh, excuse me. I mean, for my son, my son has, he's on the spectrum and he doesn't understand. And when COVID came out, we were hem and hawing, should we, shouldn't we? And to be honest with you, there was a lot of fear, when this came out, because what if he did get it? How would we explain this to him? He's in the hospital. It would be very difficult. So, again, as a family, like Nancy said earlier, you do what's best for your family and what you feel. And with no doubt, we decided to make sure that he got the vaccine.
Yeah.
And he did not have any symptoms, which was good, So again, like Nancy said, it all depends on, you may get him, everybody's different. So he did pretty well.
And later on in the PowerPoint, we're going to talk about like some accommodations, like if you have a child who's on the spectrum or you have a child with special needs, that there are other recommendations that we'll talk about, accommodations that can be provided. We'll get to that in some of the slides down. So the next slide. So this comes up quite a bit, like what if my child has a history of allergies? And they say that, there's all different kinds of allergies. There's, the food allergies, there's, even airborne allergies. My daughter has really severe allergies and, those always a worry. I actually thought that because she has allergies, she's got food allergies and like seasonal allergies as well, both of the allergies. And for the seasonal allergies, I definitely wanted to get her the COVID-19 vaccine because I thought that because she does have severe allergies, this would even protect her more. She was at an even higher risk. She's got asthma, and then she also had these seasonal allergies. So for me, having the seasonal allergies was a good indication of her to take it. So they say that youth with underlying medical conditions can receive the vaccine and receive it safely. The only reason a person should not take the vaccine is if they've had like a life-threatening reaction to other vaccines. And that's something that you will know and you can talk to with your healthcare provider. This is often one that requires anaphylactic shock and needs like an EpiPen. So you can talk to your healthcare provider about that, and they can help you to kind of figure out what the ingredients in the COVID-19 vaccine. This link here that you can follow, and Marnie she can put it in the chat a little later if she has it. It will give you like a listing of what's in the ingredients in the vaccine to help you to make that educated decision. And obviously talking to your healthcare provider, you should never do this alone. So there are the accommodations we're talking about.
So here are some accommodations, like Nancy said. So transportation for your child's appointment. So there is free transportation resources out there that exist. Here is a link that you can go to, and Marnie will also drop this in. So feel free to take a look and see if you need transportation.
And I would say that just going back to, it disappeared. Going back to the transportation, the link that we've provided here. Where's our screen blank, Carm? There we go. Okay, the ones that we've provided here, these are Connecticut specific transportation resources. Obviously, if you're watching this and you're watching it from a different state, the recommendation is to talk to your state's public health department. A lot of the agencies across the country that have public health departments locally in your state and in your county or your town or jurisdiction have all this information on there. I saw things like, there was Lyft, and I think Uber was doing it at some point. I know like Connecticut, for instance, has, they also provide like clinics where you can go, like a van that can come, that you can go to, and you can get it in the van, or um, some of the resources. So click on this link and you'll see this takes you directly to what Connecticut specifically has regarding transportation. But nobody should ever feel like, they don't. And, obviously, those are what the state provides. Talk to a neighbor, talk to a friend, a family member to help you get there. Nobody should ever feel like they can't get the COVID-19 vaccine or booster because they don't have transportation.
And again, it says transportation for your child's appointment. Again, a
For both
parent
of you.
should always, yes, the
Yes.
parent should attend with the child, of course.
And there are resources for the adults too. Just because we're talking about children and youth with special healthcare needs today, but it's both. You can do it at the same time. Go and get the vaccine with your child and have them get it as well.
There it is.
Okay, so some of the other accommodations are like, you can, if you get to the site, and Carmina, you can talk about your own experience with this, but when you get to the site, either when you're making the appointment, if you call in to make the appointment, whether this is for the vaccine or the booster, you can let the staff, or the healthcare providers that are there, know that your child has special healthcare needs. You can specifically tell them what it is, and say that they might require some extra help. Like my daughter has, she's got special needs and disabilities, and she just needed help, like prompting, like what to do, and the follow through. So you can ask your for recommendations or accommodations, such as having the provider vaccinate your child in a car if going into crowds and people is difficult for them. Maybe they have issues with, they can't sit down, because after the vaccine you're required to wait at least 15 or 30 minutes. Actually, going back to the other slide about allergies, children who have allergies are recommended to wait until for about 30 minutes so they can see the reactions. So it could be up to 30 minutes, for instance, and they might not be able to sit still. So maybe walking around helps. You need to let them know. And then, asking them to either go with you as a parent, with a guardian, caregiver, or a companion that will help them. It eases their anxiety, and they might need, like, verbal cues to help them, especially if they're nonverbal and they're being asked questions. You might be the one to help provide that. So it's important that you let them know. And sometimes it happens really fast. There are a lot of people, so trying to make that time, and making sure that you also build in time, because they might ask you to wait a little bit. Just talking them through and asking those questions. It's always easier to make it ahead of time. Sometimes that's not always possible. A lot of times right now you have to make them online, so you can't physically talk to a person, but as soon as you get there, make sure that you let them know. They could also give you accommodations by having you wait in, like, a quiet room that's away from the crowds. And Carmina, do you want to talk about, like, your own experience with Carl regarding the accommodations that you spoke to them about before I get into the home visits?
Yeah. So when we first arrived, like Nancy said, we made the appointment by phone. So I did mention it then, but they suggested that we speak to the person when we arrived. So we did. We went there and I explained to them that, he's on the spectrum and he may not understand what you're doing. But let me just go back a couple. One thing that we did do is we spoke to him about it. We have, which I think we'll bring up at one point. I apologize, Martin. I know we didn't send you any infographics on this, but we talked about the COVID shot and all of that. So that's something that we can share again with everybody later. But we went through step by step what would happen. So we explained to him, we showed him pictures. So he knew what to expect. So when we got there, we told, the nurse that, he's on the spectrum and, he may flinch, he may, so we really tried to, she tried to, talk to him and just tried to make things easy, and not rush. That was the biggest thing. It wasn't rushed. They took their time with them, which I think should be done, especially with a child with disability or special needs. You have to take that extra time, which they did, and they were fantastic. A shout out to Griffin, I will say that.
Yes.
They were fantastic. And yeah, and then, they gave him the shot and, of course he was rubbing it afterwards and all that. But of course, I also bribed him. I will say that.
Bribing always
works. It always works.
Yeah.
But the prompting.
Always best that you're honest here.
Hey, you know,
It's
some
true. You do what
whatever
you
it
have to
takes,
do.
That's
you
what
do
I
what
was
you
just
have to
gonna say.
do.
We do what we have to do as parents to get our kids through
do.
things. Yes.
That's
You
right.
do, you do, you do. So,
Do
and
what you
thank
do.
God we went at a time and we went early in the morning. So they'll know when you make that appointment, when is the most busiest? When do you think there'll be less people? Because the wait, also they get anxious.
Yes.
So they were very good at getting us in early in the morning where there weren't that many people. There was no
Mhm.
line. So there's some things that you know that your child may get anxious about. So I would definitely, when making that appointment, mention that to them.
Yeah.
And they really were fantastic.
That's
We did
good.
really well. And he's gotten so he got his booster, his 2 shots in his booster. And, it was amazing. Yeah, it worked out really, really well.
Now, was he able to sit when they told him to sit, or did he have to walk around?
He sat, but again, I kept throwing in the bribe. I kept saying, you sit down for a few minutes. And I told him what time. And I said, when it's done, we will go to, wherever you wanted to go at that time.
Yeah,
So he
ice
did okay.
cream or
Probably
McDonald's or
yeah.
something. Yeah. Yeah.
It was probably
I mean,
McDonald's.
yeah.
But you do what you have to do.
You do what you have to do to get them through it. Yeah. But
Yeah,
it's good
yeah,
to know
because-
that they were good with the accommodations. That's good. But
And again,
like you said, it's all about preparation, right?
it is. And again, I would rather have him go through this than my fear of him being in the hospital.
Yeah.
So
Exactly.
it was kind of a weighing thing, and that's what we chose. Everybody's
Right,
different. We want to keep saying that everybody is different. Every family's dynamic is different, but this is what we chose.
Yeah.
And it worked out well because we did get it, and he had it like 24 hours, and he was happier than anything after. I mean, so it was, so God knows what would have happened if he didn't, and I don't want to know,
Right. You just don't.
Right,
Yeah. Okay.
right.
Great stuff. All right. So the home visits are other accommodations that can be provided. You have a child that's homebound and cannot leave the house for whatever reason because of their medical issue or disability. You can request homebound in-home vaccination. And again, this is provided in the state of Connecticut. Not all the states have it. So this link that's here that Marnie will drop in the chat will provide Connecticut specific information. It's a short form that you have to go to the Connecticut Department of Public Health website and ask for that recommendation. You answer a couple questions and you set it up. And at that time, if that's what you're also going to have, you can also talk to them about, what's going to happen in the home, ask them questions so that you can prepare your child as Carmina did.
All right. So here it is summertime now and people are traveling. So we wanted to make sure that we spoke and talked about, what you should know prior to travel. So it's CDC does state that you should make sure that you're all up to date on your vaccines prior to travel. Check with your destination because each state, each country has their own guidelines. So make sure that you check prior to going. Wearing a mask over your nose and your mouth is always recommended indoors. So any public transportation at the airports, on planes. I think, again, being with people you don't know and not know, it's a good, definitely a good recommendation to be able to utilize and to wear all of that prior to going. And if you do not travel, and if you have COVID-19 symptoms, so again, that's, if you're not feeling well, you shouldn't be traveling, and if you test positive, make sure you test, and wait for the results to come in before you make that final, trip.
Yeah, and let me just add something about international travel. That's the most tricky part right now. Right now, within the US, you don't have to, they won't check like your COVID-19 card, your vaccine card. They don't ask you any questions about COVID. A lot of international travel is still requiring that you upload this information into their whatever airline portal. They will ask you for it also at the airport as proof of vaccination. Many of the countries that you're traveling to some of them don't have requirements to test before. Some of them do. Some of them have no requirements coming in, but requirements going out. It can be very, very tricky. So the recommendation is to do this prior to your travel so that you don't get shocked and surprised. And the other tip that I'll give you, the other pro tip that I'll give you, because I've traveled internationally and I've also had people travel internationally this summer, is if you can, because we have a lot of the home tests right now, you know, pack a couple of those with you to prepare yourself. Like I said, some airports have no requirements, some do coming in. But you don't want to get, if you have a test, test yourself. If there's no requirement of going, maybe when you come in or you're going out, sometimes at the airports, and even if they don't require it, a lot of airports are just like asking people for their COVID-19 test. This has happened to a couple of people internationally, and they're surprised because it was not a requirement that they thought of, end up having COVID and are required to quarantine prior to leaving. And you can get stuck with hotel bills that you pay out of your own pocket to quarantine. And some of them have 7-day quarantine, some have 14. It's like, you know, so different rules for different countries right now, and you just don't know. So if you want to save yourself some heartache, whether or not it's required, maybe just test so that you can make, you know, it might be easier for you to actually stay where you are, stay put in the place that you're in, if you can, you know, prior to traveling. If you test positive, just do that rather than getting to the airport and then finding out you have to take the test for whatever reason and then getting stuck and quarantined, you know, in a place that you're not familiar with. So
Yeah, that's a great thought, because again, test before you even get to the airport, because you're either staying with family or somewhere that you are comfortable with, better than going to the airport and staying at a hotel or whatever. So that's
yeah,
a really great idea to mention about bringing some samples with you. I haven't traveled outside the country yet, so I mean,
yeah. And
but that
even
is a really good
within
point.
the
Yeah.
US, I would just say if you're traveling outside of your state, throw a couple of those tests in your bag, because again, right now, because we're kind of, you know, the at the height of COVID, there were testing centers everywhere, right? A lot of those testing centers are gone now. So you literally have to either look for CVS or Walgreens or any other pharmacy that's providing them. If you don't know where those are, if you don't have a car to get to them in a different state, it's going to be tricky, could be an added cost. Whereas if you do have the little test kits, you know, and you feel sick, you know, you can just test yourself, and then, you know, and you can go maybe to like an urgent care center or something. So it's just always just a pro tip recommendation to just do that.
So
Yeah.
one more quick question, because you have experience there, but so if you were to test prior to going to the airport, and you're at an airport that, or a country that wants to see proof, do you actually bring your test kit with you
And
to
take
show
a
them?
picture with you. Yeah,
Just
a
take
lot
a
of
picture.
them.
Okay.
Many airports are requiring you to show your COVID-19 vaccine card, right? So a lot of times that's okay, but randomly, because now the BA5 variant is, you know, things that guidance is changing everywhere. You know, I know somebody who got stuck internationally, ended up having to pay, you know, hotel in a foreign country. You know, a couple of people that I've known that were traveling like within Europe, and they got stuck. They didn't know that they had to get the vaccine after, because they thought everything had been dropped. And, you know, we were traveling from Africa, from Uganda, when we're coming back. Going in, we had our vaccine cards. We showed those proof of vaccine. Going in, we didn't have to do a PCR. Coming out, we had to do a PCR. But we didn't see it until literally, and by the way, we saw it like literally within a few days before we traveled. Now, it used to be that you could do it 72 hours prior, and we thought, oh yeah, we're good. When we looked a little deeper, we found out that it had to be 24 hours within our travel. And thank goodness the country that we were in still has many vaccine places open. I mean, testing centers that you can go to, and we were able to get it 24 hours prior. But, you know, if you don't know, you don't have access, that can be devastating. They will not allow you to travel, and then you'll be stuck wherever you are. Or sometimes they'll force you to not force you, but they'll say, well, if you don't have anywhere to go, sit here for 24 hours, and, you know, you can get the test at a hospital. I mean, not a hospital, within airport service, and those are expensive. Very, very expensive. I think like I remember the PCRs that we last year, we were looking into them at the airport. I believe it was in DC, and it was $250 PCR
Mm.
test per person. You don't want
Wow.
those shocks. And,
Wow.
obviously a lot of that is not required now, but you just never know right now with a BA.5
Mm.
variant. So it's just really doing your homework and trying to figure out like, what you need prior to going. And then checking like your airline. Don't just go with what the recommendation of the country is. Also check the airline, because you could have an airline that's traveling into a country that's not theirs, but then that particular airline, because in their country, they require vaccines. So if you're going to do like maybe a layover in a different international country, they might require the PCR and you don't even know it. So it's checking also with the country, if you're layover country, and the airline that you're traveling. Okay.
Really good info. All right, let's see. So again, make sure to plan ahead, like Nancy said. And I think we covered all of this already, so we kind of jumped way ahead. And again, make sure you follow the all state, tribal, local, overseas, anything, their guidelines, double check it, triple check it, because again, like Nancy said, they change very quickly.
You want to go ahead and cover that one?
I was going to say, can you cover it? Because I need to get my battery before we get.
Okay, sure. So if you have a medical condition or taking medications that weakens your immune system, you might not be fully protected, even if you're up to date with your COVID-19 vaccines. So again, it's like talking to your healthcare provider to figure out what your situation is, doing your own risk analysis, because even after vaccinations, you may need to continue taking all precautions. And again, we're talking about that before. We don't know how the variant is right now with the different variants that are coming out of Omicron. And, sadly right now, whether you're, you could be double vaccinated, boosted and even double boosted, and unfortunately still get, especially if you have a weak immune system and other underlying medical conditions, it just opens you up to, and it makes you more susceptible to getting the virus. So you want to talk about that with your healthcare provider. The one thing that these boosters, the vaccines and the boosters do is they reduce or they reduce the risks of you getting severely ill and ending up in the hospital, which could be, devastating. So that's why, even 2 years after, they're recommending that people get the vaccines no matter what, because it does help. It does help you to, to stay out of the hospital and get really sick. Again, we talked about like traveling by air. Make sure you check the airline for testing requirements and vaccines and all those other documents. And then being flexible during your trip, as there's still many restrictions and policies that could change at the drop of a hat. I remember during the beginning of the virus, everything was changing like day to day, sometimes hour to hour.
And those are really all great tips that you had mentioned as far as traveling. So definitely keep that in mind.
Lived experience. Sometimes you learn the hard way. Yeah.
That's true. It's true. But you're saving other people the heartache, and the aggravation. So that's really great points. So do you need to wait till after you get the flu vaccine or another vaccine before getting the COVID-19 vaccine? So no, there's no recommendation to have to wait. So you can get the COVID vaccine shot along with the flu shot or any of other same types of shots. Experience with other vaccines has shown that the way the body develops and the protection known as the immune response and possible side effects after getting the vaccination are generally the same when given alone or with other vaccines. So I think if I'm correct, they are working on putting the COVID vaccine with the flu this coming fall. So that would be nice. So you only have to go once to get them both.
Now I wonder if you've been like I'm double vaccinated, double boosted. So are they saying they would give you them at the same time? Is that what they're saying?
That's what it sounds like. Yeah.
So I wouldn't need to get another booster because I'm already boosted, right? So I would just get the flu shot at that point, I think.
I would think yes. I mean, I think if you already got your second booster, they're not going to all throw the flu and the booster together, because again, there's some people for their own prerogative that maybe they don't want that COVID shot just yet. But they are having that ability, that, they're putting the two together.
Yeah.
Which again,
And,
for kids with special needs might help because, again, for my son, I mean, he'd rather go for one instead of having to take them twice,
Yeah.
So it,
Marnie, did you
it
want to?
depends.
Yeah, no, I was just gonna say, I know with different vaccines that my kids have had, the guidance was different a year ago, where they didn't want the kids to have a regular vaccine. I'm trying to remember what it was for one of my kids. Maybe it was the meningitis. They didn't want them to have it within a certain time length of COVID. And it was funny, by the time we went back for her vaccine, that guidance had changed and they were fine doing them. So it's really just important to talk to your doctor, pay attention to what the current guidance is. They're doing this every day, they know, but it is, I know that they are saying it's okay to do with other vaccines now. Again, check with your own doctor, but I just thought it was interesting that changed while we were in the middle of doing vaccines. They changed that guidance. So things change all the time.
Yeah, absolutely. It's, and this variant is just like so complex that, there's a lot of things that are still being learned and have been learned over those 2 years. The other thing I was going to say about this is that yourself as a person and your child, like how the reaction is to a vaccine, any vaccine that they get. So, again, like Marnie said and Carmina said, talk to your healthcare provider about this. If your child or yourself has had, those reactions, they might say, you know what, maybe spread it out a little bit. So again, it's like asking those questions, but yourself and your child better. So take those questions to your healthcare provider to determine that. Okay, so where can you get your COVID-19 booster shot? So right now, fortunately, there's many places that you can get your booster shot, the first and the second dose. And they've been very good at telling you when to come back to get your second booster, or just like they did with the vaccine. But still, this is actually still a little confusing. So you don't know. I know I wondered, like after I had gotten my first vaccine in November, then I went back sometime in April. I wondered when the right time to do it was. I got it in the fall. So I was thinking, well, should I get it now because I need to be protected for this year? Or should I wait until the fall because that's when flu season goes up? There's still a lot of questions about this. And, you can ask your healthcare provider, even at the pharmacies. The pharmacists have pretty good information. They can give you some advice on that, about when to spread out or when to get it, when the best time to get it is. The link that's provided here, vaccines.org, gives you some good information. So Carmen, if you could just drop all of those, just drop them all there. So right now, thank you. They're saying that everyone who's 5 and older should get boosted. Individuals without access to the internet who are not able to schedule their COVID-19 vaccine online can dial. This is Connecticut specific, so dial 211 for assistance, or call the toll-free number that's provided there. Individuals who are medically or physically unable to leave their home can receive it within their home. We gave you that information. Again, this is COVID-19. I'm sorry, not COVID-19, Connecticut specific. And you can follow that site to get the information about the vaccine. But I wanted to talk about the timing of it, which I found interesting. Now, Money will drop in the chat. She's going to drop a link. I'm sorry, not a link. She's going to drop an infographic that we provided. And some of it gave some really good information that was really, really helpful about when, the timing that you should. Carmine, I'm not sure if
I'm sorry, I'm just going to break in.
Okay.
It won't let me post graphics in the Facebook Live chat. So they will be up on our main Facebook page. As soon as this ends, the infographics will go up on our Facebook page.
Awesome. Okay. Well, I can talk about them here, and I'm not sure if they're in the presentation, Carmina, so stop. This is some of the information that we got from the AUCD site that we talked about earlier. and the Connecticut Department of Public Health. So they're saying, so there's also confusion. So if you get your first booster, if you receive Moderna or Pfizer, you should try and take it at least 5 months after you got your second shot. So that's the booster after your 5 months after your second shot. If you received the J&J, Johnson and Johnson, you have to wait, because which is one shot, you have to wait at least 2 months after you got your shot. And then which booster should you get? So if you're 5 to 17 years, the recommendation is Pfizer. If you're 18 years and older, any of the COVID-19 authorized in the US, Pfizer, Moderna, and Johnson and Johnson are good. But I like that information about the timing. So it was saying after your second shot, you're eligible for 2 boosters. If you're 50 years or older, you can get the first booster at least 4 months after. And then if you're moderately or severely immunocompromised and you're 12 years or older and got your first booster at about 4 months ago, and then you got 2 doses of Johnson and Johnson at least 4 months ago, this is when you can get your second booster. So I'm talking about when you should get your second booster after you got the first booster. And then when to get your second booster. So if you received the COVID-19, sorry, if you received Pfizer or Moderna, at least 4 months after your first booster, you're eligible to get the second booster. So it's a 4 months difference. So I was a little, let me see, November, December, January, February, March. So it's kind of on time, about 4 months. But now I'm double boosted. I wish I had kind of waited until maybe the fall. We'll see. So the infographics that we'll post will give you that information. And obviously, if you have any questions, talk to your healthcare physician. Obviously, that's the first place. You can always call your Department of Public Health, ask them questions, and also you can talk to your pharmacy, and they can give you guidance. That's kind of what when I went into a pharmacy, I told them I received my booster in November, and they said, "Oh yeah, come back around April or March." Okay, next slide.
Okay, so can you just walk in or do you need an appointment? So there are walk-ins, but I would advise to call and try to make an appointment. Again, having a child or an individual with special needs, you want to alleviate all that anxious and the anxiety. So it would be good to actually call prior to see it, and call your physician, call the pharmacies, the clinics in your area to see. There we go. To see, if they have anything available. Again, there are walk-ins, so if, let's say you call for an appointment and you have to wait a week or 2 or whatever, you're going away, for instance, in the next month, there are walk-ins, and here is a link right here that Marnie will also put up to kind of show you, to where they're located in the state of Connecticut. Like Nancy said, these are specific to Connecticut. But again, I mean, you can do the walk-ins, you can call for an appointment. It's whatever works for you.
Yes. These vans here, the link that's provided here is the Department of Public Health van clinics, which are located in many communities, so it might be one is available in your community, and these are, the link will take you to, and you can look at a list of where they are located, the vans, the van clinic. So you might not have to go to an urgent care. You don't have to go into a hospital or to your healthcare provider. You can just see what's available at your pharmacy or within your clinic through one of the van clinics.
Right. So with that said, we've reached the end of the presentation. And we want to thank everybody. Hopefully you really received a lot of great information here. Like Nancy said in the beginning, it has been 2 years, but this is still going on, and there's still precautions that we need to take over the, the next, with the summer coming, and then the winter's coming back, and the traveling now in the summer. So there's just a lot that, you still need to be aware of. So we wanted to share this with you. Again, the links, Marnie posted on our Facebook page, and she's going to upload those infographics that Nancy spoke about. Feel free to see, reach out to our or to visit our website, because we do have some of this information on our resources page there.
And this will be, this has been recorded. It'll be up and available on YouTube, as well as here on Facebook. You can watch it. You can watch it with friends, share it. Again, ask questions. The bottom line is the key takeaways is that unfortunately, COVID-19 is still with us very much, with different variants popping up every time. The name of the game is doing your own risk analysis. And if you have questions, always the best person to talk to is your healthcare provider. So we've provided these recommendations. We source the information from the CDC. We source the information from the AUCD, information for people with disabilities. So these are trusted entities. We've provided you not our own opinions. The stories were our own lived experience stories, but we didn't make any of this stuff up. It is from vetted information, I mean, it's important to say that because of
It's true.
misinformation and
Yep.
disinformation,
Yep.
and all this information. But, you have any questions, always talk to your healthcare provider. And again, these are all recommendations. It's our job to do education about this. Everybody makes a decision whether or not to take the vaccine is your own choice. Whether to give the vaccine to your child is your own choice. We can only do what we can to educate people and then give them information so that they can make the best educated decision. Yeah. So thank you very much for
Very well
listening.
said.
And I also put a link to our email. If you have any questions about this presentation or anything that we might be able to answer, feel free to email us. The link is in the chat. It's info@pathct.org.
Great. So
Happy
thank
summer.
you, everybody. Yeah. Have a
Everyone
great rest of the
stay
day.
safe.
That's right.